Breast cancer is a disease that starts in the cells of the breast. Cells are the tiny building blocks of our bodies. Usually, cells grow and divide in an orderly way. When cancer happens, cells in the breast start to grow uncontrollably. These cells can form a lump called a tumor. There are two main types of breast cancer. Invasive breast cancer means the cancer cells have spread from where they started into nearby breast tissue. Non-invasive breast cancer means the cancer cells have stayed within the milk ducts or lobules of the breast. Breast cancer is a serious disease, but many people can survive it, especially if it's found early. Scientists don't know exactly what causes breast cancer. However, we do know that certain things can increase a person's risk. These are called risk factors. Age. Getting older is a major risk factor. Most breast cancers happen in women over 50. Family history. Having a close relative like a mother, sister, or daughter with breast cancer increases your risk. Genetics. Certain gene changes, like in the BRCA1 and BRCA2 genes, can greatly increase the risk of breast cancer. Hormones. Being exposed to estrogen for longer periods of time, like starting your period early or going through menopause late, can increase risk. It's important to remember that having a risk factor doesn't mean you'll definitely get breast cancer. Many women with risk factors never develop the disease. Early detection is key in the fight against breast cancer. Finding it early, when it's small and hasn't spread, gives you the best chance of successful treatment. There are several ways doctors can diagnose breast cancer. Mammograms. These are low-dose X-rays of the breast. They can often detect tumors before they can be felt. Breast exams. Doctors can examine the breasts for lumps or other changes. Ultrasound. This test uses sound waves to create images of the breast. It can help determine if a lump is solid or filled with fluid. Biopsy. This is the only way to know for sure if you have cancer. It involves taking a small sample of cells from the breast and looking at them under a microscope. If you notice any changes in your breasts, such as a new lump, skin changes, or nipple discharge, it's crucial to see your doctor right away. If breast cancer is diagnosed, there are several treatment options available. The best treatment plan depends on the stage of the cancer, the type of cancer, and the individual patient's health and preferences. Surgery. This is often the first line of treatment. It involves removing the tumor and some surrounding tissue. Radiation therapy. This uses high-energy rays to kill cancer cells. It can be used after surgery to destroy any remaining cancer cells. Chemotherapy. This involves using drugs to kill cancer cells. It can be given intravenously or in pill form. Hormone therapy. Some breast cancers are fueled by hormones like estrogen. Hormone therapy blocks the effects of these hormones, slowing cancer growth. These treatments can be very effective, but they can also have side effects. Your doctor will discuss the potential risks and benefits of each option with you. Scientists are constantly working to develop new and more effective treatments for breast cancer. Some of the most promising advances include targeted therapy, immunotherapy, and gene editing. Targeted therapy involves drugs that focus on specific proteins or genes involved in cancer cell growth. They can be more effective and have fewer side effects than traditional chemotherapy. Immunotherapy helps the body's own immune system fight cancer. It can be used to boost the immune system's ability to recognize and destroy cancer cells. Researchers are exploring ways to use gene editing techniques like CRISPR to correct the genetic mutations that can cause cancer. These new treatments offer hope for a future where breast cancer can be more effectively treated and potentially even cured. While you can't completely eliminate your risk of breast cancer, there are things you can do to lower your chances of developing the disease. Maintaining a healthy weight, eating a balanced diet, exercising regularly, and limiting alcohol consumption can all reduce your risk. Mammograms can detect breast cancer early when it's most treatable. Talk to your doctor about the right screening schedule for you. If you have a strong family history of breast cancer, genetic testing can determine if you carry certain gene mutations that increase your risk. Knowing your risk can help you make informed decisions about screening and prevention. Taking proactive steps to reduce your risk and getting regular screenings are crucial in the fight against breast cancer. A breast cancer diagnosis can be overwhelming. It's important to remember that you're not alone. There are many resources available to provide support, information, and guidance. Connecting with others who understand what you're going through can be incredibly helpful. Support groups provide a safe space to share experiences, offer encouragement, and learn from one another. Coping with a cancer diagnosis can take an emotional toll. Therapists and counselors can provide coping mechanisms and emotional support. Don't be afraid to lean on your loved ones for support. Let them know how they can help you through this challenging time. Remember, asking for help is a sign of strength, not weakness. Researchers are making significant strides in understanding breast cancer and developing new treatments. Scientists are working to develop treatments tailored to an individual's specific tumor. Researchers are exploring new technologies like liquid biopsies that could detect cancer earlier and more accurately. Ongoing research is identifying new ways to prevent breast cancer, such as developing vaccines and chemoprevention drugs. The future of breast cancer treatment is promising, offering hope for more effective and less invasive treatments. Breast cancer is a formidable foe, but it is not invincible. Early detection is our greatest weapon in this fight. Know your breasts and be aware of any changes. Mammograms are crucial for early detection. Make choices that can reduce your risk. Together, through awareness, early detection, and advancements in treatment, we can win the battle against breast cancer.